Hello and welcome back. My name is Lizette and today's video will be everything that I experienced in my first trimester. I am now on my second trimester, so I thought now would be a good time of all the symptoms I experienced plus some tips to combat some of those symptoms. Okay, so symptom number 1, tender breast. This is how I first found out I was pregnant. The tenderness of my breast was definitely different from my cycle, and I just knew there was a change of my body. Well, that feeling, you're going to have it constantly throughout your first trimester and so on, but you're going to really feel it while you're sleeping. I feel like my breasts feel like rocks when I'm sleeping, and although I'm smaller, I feel like I have to move them anytime I position myself differently when I'm sleeping. Another thing about my breast is that my nipples have been getting dry. So something that I've been doing just to soothe the pain and the dryness is I massage a body butter on my nipples, my breast, and also my belly as well. Symptom number 2, weight loss. In my first trimester, I lost about 5 pounds. I was freaking out because no one intends to lose weight while they're pregnant, but it makes sense because you're hardly eating, you're grossed out by food, well at least I was, and you're vomiting at times, you're feeling nauseous. So I lost weight, I just gained all that back, but if you're losing weight in the first trimester, that is a possibility that that will happen. So if that happens, just don't freak out. Know that you're going to gain the weight back. If you do not want to eat or have a difficult time eating in your first trimester, I really recommend just snacking throughout the day, finding something that you're not grossed out by, like maybe crackers. I ate a lot of bread a majority of the time. I personally could not eat over seasoned food, so a lot of my food was simple and plain. So I had eggs with maybe just a little bit of salt and a piece of toast, and that's all I could eat. Keep foods simple and keep foods plain. That's what worked for me. Also, since you probably won't be eating as much, it is important that you are taking a prenatal vitamin. Number 3, which is the most common one, is feeling morning sickness or nauseous. So I thought morning sickness was only in the morning, but that can be at any time of the day. One moment you're okay, and then an hour later you suddenly want to throw up out of nowhere. Luckily for me, I was very intuitive with my body, so I can walk to the restroom and prepare myself for when I needed to vomit, or ask my husband to pull over in case I needed a moment for myself. So if this happens, your doctor may recommend a medication. I personally stay away from any medications, so something that I did is drink ginger tea, and I also had a lot of ginger chews, which are these. I had these multiple times throughout the day. Number 4, congestion. I was always congested or having sinuses. I thought I was sick, but then as 2 weeks passed, I realized I was not sick and I was just really congested, until I found out that was a normal symptom of pregnancy, and that is because you are having more blood flow, so the veins in your nasal passageways are enlarged, which causes you to have congestion. So if that happens to you, that is completely normal. So something that you can do is a nasal rinse or a steamy shower to just help everything flow out. 5, cramps. This is the one that probably worried me the most because I always had the most crazy thoughts and thought that I was having a miscarriage, but the cramps are completely normal unless it's a sharp pain. If you experience cramping, it is completely normal. There's a lot of hormonal changes going on. Not only that, your uterus is expanding, so your ligaments are also loosening up, which creates the cramps in your stomach. The only time you should be worried is if you experience sharp pain and bleeding after that. But the cramping is completely normal. So something that I do now is I'm extremely mindful of my movement. So now when I get up, I don't just rapidly get up, I get up slowly. If I'm on the side of my stomach when I'm resting, I'm also mindful of how I'm turning around. Sometimes I even hold my belly for comfort. I'm not sure if that helps, but it does keep me comfortable. So if that happens, it is completely normal. And I want to share that now because my doctor didn't explain that to me. So it was something that I was always worried about. And luckily I reached out to my sister that is a nurse, and she told me why that's happening and did reassure me that it's completely normal. Number 6 is constipation. You will be freaking constipated, okay? It's so uncomfortable. I'm sure we've all experienced being constipated for a few days, but just imagine throughout the weeks. So something that I did is take beef liver tablets. I'll link it down below. I also switched up my water. I could no longer have plain water because it grossed me out and it made me nauseous. So instead I had flavored water, and I actually still drink that, and I use liquid IV to spice up my water, and that'll help you to stay hydrated because it's very common while in the first trimester to not really drink as much water as you're used to. So hydrate, take your vitamins. I'm sure moving your body helps as well. Number 7, I feel like this is the most important one to mention, but it's mood swings. I am still going through it, but I went through so many mood swings, and I went depression, anxiety, everything, you name it. One moment I'm sad, and then I'm super grateful. I had thoughts about how excited I am to be a new mama, and then later on that night I'm just so fearful, thinking that I won't be a good enough mother. So if you're having these thoughts, don't think that you're crazy. It's just the hormone changes. Things that I did to help with that is have a baby journal. Well, I started journaling. I called it the baby chronicles. I tracked all of my thoughts, my emotions, even the changes of my body, just in case you're worried about anything and want to bring it up to your doctor. But just keeping track of everything and then reflecting back on it, just so you know, like, oh wait, my mind is just telling me lies, like none of this is true. Or realizing something and having a little bit more clarity. Another thing that I am currently doing is going to therapy. I'm just the type of person that needs a little bit of accountability or likes a little bit of guidance, so I decided to go to therapy just to help process my thoughts and just to help control my outbursts that I was having. And another important thing for your mood swings is communication. Communicate with your family, with your significant other. Just let them know, like, hey, I'm having a rough day today. Something that I did is communicate with my parents that I can't always make it to family gatherings because being in a group setting gave me anxiety. And they love to give me guilt trips for not attending certain things, or not visiting as much as usual, so I had to let them know some days I just don't feel well physically or emotionally, and I hope you can understand that you're not going to see me as much as you're used to. Another thing, I had to communicate with my partner about certain foods. So one situation that I can bring up, I was having a day where I can easily consume meat, but then the day came to cook meat, and looking at it raw just completely disgusted me, feeling the texture of it. So I had to let my partner know, this is grossing me out, I will not be able to cook this meat, please cook this meat for me, or us. So those are my 7 symptoms that I experienced in my first trimester. A lot of them may be similar to you, but a reminder, all of us are different, so you may not have the same symptoms that I did. An honorable mention in all of this, I would love for you to download the Flow app. It tells you everything that is happening with your baby, all of the changes that are happening in your body. Not only that, it has guided meditation. It has everything you can think of to help support you in your pregnancy journey for your first time. Anything I forgot to mention, I'll link it down below. But thank you so much for watching, and I'll see you next time. Bye. Hello.